Welcome back to our science show. Today, we've got a short but juicy one. A genetic study suggests the same inflammatory pathway can be both harmful and protective, depending on whether IL-6 or its soluble receptor is involved. Ready?
Ready. Quick teaser. A Mendelian randomization analysis in aging looked at IL-6 and soluble IL-6R and found some striking causal links to mortality and several diseases. Sounds technical? Don't worry, we'll break it down step by step.
Okay, start simple. What is Mendelian randomization in plain English?
Imagine running a randomized trial, but the randomization is done by the genes you were born with. Some genetic variants cause lifetime differences in levels of a biomarker. Because genes are fixed at conception, they're less prone to the usual confounders or reverse causation, so they can help us get closer to true cause and effect.
So genes act like nature's random assignment. Neat. What did this study specifically find about IL-6 and IL-6R?
The headline is neat and simple. Genetic predisposition to higher IL-6 levels was associated with increased overall mortality, while genetic predisposition to higher circulating soluble IL-6R was associated with lower overall mortality and protective effects against lung cancer, type 2 diabetes, stroke, and coronary artery disease. In short, IL-6 looks harmful, soluble IL-6R looks protective.
That's like the same signaling pathway having two opposite roles. Mechanistically, how does IL-6R protect you?
IL-6 is a pro-inflammatory cytokine involved in vascular inflammation, thrombosis, and dysfunction. Soluble IL-6R, which circulates in blood, can bind IL-6. That binding can prevent IL-6 from activating inflammatory pathways in blood vessels and heart tissue. Think of soluble IL-6R as a kind of circulating decoy or bodyguard that keeps IL-6 from wreaking havoc.
Nice metaphor. The paper also looked at CRP and GDF15, right? What happened there?
Yes. Importantly, CRP and GDF15 did not show causal effects in this Mendelian randomization analysis. That suggests they may be markers of disease rather than direct causes, a meaningful distinction when planning interventions.
Good. Now, researchers usually run sensitivity checks. What did they do to make sure the results aren't flukes?
They took several careful steps. They only used genetic variants strongly associated with the exposure to avoid weak instrument bias, performed leave one out analyses to ensure no single variant drove the result, and checked for reverse causation. These robustness checks support the main findings: IL-6's harmful signal and IL-6R's protective signal.
Clinically, is there already a drug that targets this pathway?
Yes. Tocilizumab is an IL-6R antagonist used for conditions like rheumatoid arthritis and giant cell arteritis, and it has shown mortality reduction in some severe COVID-19 studies. That pharmacological evidence aligns with the genetic findings, but, and it's a big but, using such drugs long-term to prevent cardiovascular deaths isn't proven and requires trials to assess efficacy and safety.
Speaking of caveats, what are the main limitations listeners should keep in mind?
Several key caveats. Mendelian randomization reflects lifelong, usually modest genetic effects, not necessarily the impact of a short, strong drug. Pleiotropy, genes affecting multiple pathways, could bias results. Long-term IL-6 blockade might increase infection risk or affect immune surveillance. Also, the study didn't find effects for Alzheimer's or kidney disease, so benefits aren't universal.
So the takeaway in one line.
Genetic evidence points to IL-6 as a harmful pro-inflammatory factor, while higher circulating soluble IL-6R may protect against several cardiovascular-related outcomes by neutralizing IL-6, but clinical translation needs careful testing.
Final friendly reminder, this is science communication, not medical advice. If you're curious to support our work, subscribe, leave a review, or donate. Every bit helps.
Thanks for listening. Stay curious and skeptical. That's how science advances. See you next episode.